Question 1. During an orientation tour, a new nurse asks an SPD technician why the facility's sterilization protocols do not attempt to eradicate every single microorganism on Earth. The lead clinical educator explains that the vast majority of environmental and gut microorganisms are actually essential for life or benign, and we only target specific disease-causing pathogens. What estimated percentage of bacteria is scientifically considered not harmful to humans? A. 75%. B. 80%. C. 90%. D. 95%. Correct answer C. Knowledge point explanation. Core rationale. In fundamental microbiology, it is a commonly accepted estimate that approximately 90% of all bacteria are non-pathogenic, not disease-causing, and are actually beneficial or harmless to humans, such as those aiding in digestion or environmental decomposition. Trap analysis. Options A, 75%, B, 80%, and D, 95%, are incorrect estimates within this specific context. While precise ecological numbers fluctuate, 90% is the standard baseline taught in sterile processing curricula to emphasize that pathogens represent only a tiny fraction of the microbial world. Concept extension. The remaining small percentage of disease-causing microorganisms are referred to as pathogens, which are the primary targets of the decontamination and sterilization processes. Question 2. While evaluating a rigid container system, the SPD manager notes that if instruments are packed with excessive moisture and stored in a completely sealed, air-deprived environment, certain dangerous pathogens can thrive. These specific organisms, such as those causing tetanus, are able to survive and multiply without which of the following? A. Oxygen. B. Temperatures above 100 degrees Fahrenheit 37.7 degrees Celsius. C. Moisture or water. D. Organic soil nutrients. Correct answer A. Knowledge point explanation. Core rationale. The definition of an anaerobic bacterium is one that does not require free oxygen for metabolism and growth. The prefix in dash means without, and aerobic refers to oxygen. Trap analysis. Option B is incorrect because many anaerobes are mesophiles that thrive around human body temperature, 98.6 degrees Fahrenheit, not strictly above 100 degrees Fahrenheit. Option C is incorrect because all bacteria, including anaerobes, require water to transport nutrients and waste. Option D is incorrect because they absolutely require a food source, nutrients, to survive. Concept extension. Because anaerobes can survive in deep puncture wounds or sealed microscopic environments, thorough mechanical cleaning to remove the protective bioburden is critical. Question 3. When comparing the biological characteristics of different infectious agents encountered in the decontamination area, which statement accurately describes the relative size of viruses compared to other pathogens? A. They are significantly larger than bacteria. B. They are classified as gram-positive microorganisms. C. They are significantly smaller than bacteria. D. They are classified as gram-negative microorganisms. Correct answer C. Knowledge point explanation. Core rationale. Viruses are subcellular infectious agents that are significantly smaller than bacteria. They are so small that they cannot be seen with a standard light microscope and require an electron microscope for visualization. Trap analysis. Option A is factually incorrect. Bacteria typically measure 1 to 5 microns, whereas viruses are measured in nanometers, much smaller. Options B and D are incorrect because gram staining is a classification method based on cell wall structure used strictly for bacteria. Viruses do not have cell walls and cannot be gram stained. Concept extension. Despite their microscopic size, enveloped viruses, like HIV and hepatitis B, are generally highly susceptible to standard low-level disinfectants due to their fragile lipid outer layer. Question 4. During a steam sterilizer qualification test, a technician places a biological indicator vial inside a test pack. The educator explains that the specific microorganism inside the vial is chosen because it exists in a dormant, highly resistant state. By definition, what is the primary characteristic of a bacterial spore? A. It acts as the genetic control unit of a eukaryotic cell. B. It is extremely fragile and very easy to kill. C. It is exceptionally difficult to kill using standard methods. D. It is located permanently within the cell nucleus. Correct answer C. Knowledge point explanation. Core rationale, a bacterial endospore, spore, is a highly resistant survival structure that protects the organism's genetic material from extreme heat, chemicals, and lack of water, making it exceptionally difficult to kill. This resistance makes spores the benchmark for validating sterilization cycles. Trap analysis. Option A is incorrect because the control unit of a eukaryotic cell is the nucleus, not a spore. Option B is incorrect because spores represent the highest level of microbial resistance, the exact opposite of being fragile. Option D is incorrect because spores form within the cytoplasm of certain bacteria, and bacteria, prokaryotes, do not even possess a true nucleus. Concept extension. Geobacillus stereothermophilus spores are used to test steam and vaporized hydrogen peroxide sterilizers, while Bacillus atrophius spores are used for ethylene oxide (ETO) testing. Question 5. In the microbiology of healthcare-associated infections, Staphylococcus is frequently identified as the causative agent of surgical site infections. Based on standard diagnostic staining techniques and its cell wall structure, how is Staphylococcus correctly categorized? A. Gram-positive bacteria. B. Gram-negative bacteria. C. Subcellular infectious prion. D. Enveloped viral agent. Correct answer A. Knowledge point explanation. Core rationale. Staphylococcus is a genus of spherical bacteria, cocci, that possess a thick peptidoglycan cell wall. This thick wall retains the primary purple dye during a gram stain test, definitively classifying it as a gram-positive bacterium. Trap analysis. Option B is incorrect because gram-negative bacteria, like Pseudomonas, have a thinner cell wall with an outer lipid membrane and stain pink/red. Options C and D are incorrect because Staphylococcus is a living bacterial cell, not a proteinaceous prion or a virus. Concept extension. A particularly dangerous strain encountered in sterile processing is methicillin-resistant Staphylococcus aureus, MRSA, a multidrug-resistant organism, MDRO, that poses a severe threat to patients. Question 6. While preparing a manual soaking sink in the decontamination area, a technician reviews the manufacturer's instructions for use, IFU, for a new enzymatic detergent. The IFU states that the chemical solution must be mixed with water that maintains a neutral to slightly alkaline state, around 7.0 to 7.8, to prevent protein denaturation. Which standard chemical measure specifically refers to this level of alkalinity or acidity? A. Relative humidity. B. Temperature degrees. C. Hydrogen ion concentration, pH. D. Moisture content. Correct answer C. Knowledge point explanation. Core rationale. In microbiology and sterile processing chemistry, pH is the universal scale used to measure the acidity or alkalinity of an aqueous solution. Most pathogenic mesophiles prefer a neutral pH, and detergents are formulated to operate optimally within this precise window. Trap analysis. Option A is incorrect because relative humidity measures the amount of water vapor in the air, essential for evaluating sterile storage environments, not the chemical acidity of a liquid. Option B is incorrect because temperature measures heat, e.g., mesophiles thrive at 68 degrees Fahrenheit to 113 degrees Fahrenheit, not alkalinity. Option D is incorrect because moisture content refers to the presence of water needed for bacterial growth, completely unrelated to the chemical acid-base scale. Concept extension. An environment that becomes too acidic, low pH, or too alkaline, high pH, will disrupt the internal life processes of the cell and cause the pathogen to die. Question 7. During the sort and discard phase at the decontamination sink, a sterile processing department, SPD, technician accidentally sustains a sharp injury from a contaminated scalpel blade hidden beneath a pile of bloody sponges. During the post-exposure medical evaluation, the occupational health nurse discusses the risks of various blood-borne pathogens, highlighting one specific virus that currently stands as the most prevalent chronic blood-borne infection. Which virus is the nurse referring to? A. Hepatitis A. B. Hepatitis B. C. Hepatitis C. D. Hepatitis D. Correct answer C. Knowledge point explanation. Core rationale, hepatitis C, HCV, is widely recognized in healthcare epidemiology as the most prevalent chronic blood-borne infection today. It has a uniquely high tendency to develop into a long-term, chronic disease, leading to severe liver damage. Trap analysis, option A is incorrect because hepatitis A is transmitted via the fecal-oral route, often through contaminated food or water, and typically causes an acute, not chronic, infection. Option B is incorrect because while hepatitis B is a severe blood-borne pathogen, it has a highly effective vaccine and turns into a chronic infection at a much lower rate than hepatitis C. Option D is incorrect because hepatitis D is a defective satellite virus that requires the host to already be infected with hepatitis B to survive and replicate. Concept extension, because there is currently no vaccine for hepatitis C, standard precautions and the strict use of personal protective equipment, PPE, are the only effective barriers in the decontamination area. Question 8. In the study of highly infectious viral diseases and epidemiology, understanding the timeline between initial exposure and the onset of symptoms is critical for infection control protocols. Which specific virus is epidemiologically characterized by an incubation period that ranges from 2 to 21 days after exposure? A. SARS-CoV-2, COVID-19. B. Ebola virus. C. Human immunodeficiency virus, HIV. D. Creutzfeldt-Jakob disease, CJD, prion. Correct answer B. Knowledge point explanation. Core rationale, the Ebola virus is scientifically distinguished by its specific incubation period, which ranges from 2 to 21 days. This strict parameter is a key identifying feature used by public health officials to establish quarantine guidelines during an outbreak. Trap analysis, option A is incorrect because the typical incubation period for the SARS-CoV-2 virus, causing COVID-19, is generally recognized as 2 to 14 days, not up to 21 days. Option C is incorrect because HIV can have an incubation period of months to years before manifesting into severe disease, far exceeding the 21-day window. Option D is incorrect because CJD is caused by a prion, not a virus, and its incubation period is exceptionally long, often spanning years or decades before symptoms appear. Concept extension. The incubation stage is just the first step in the chain of infection. Once the vegetative stage is reached, the pathogen begins active replication and becomes highly transmissible. Question 9. Every morning, the quality assurance technician must run a biological indicator in the steam sterilizer to prove the machine can effectively kill the most resistant microorganisms. The test utilizes the highly resilient spores of Geobacillus stereothermophilus. Based on structural microbiology and gram stain classifications, what type of organism is this specific biological benchmark? A. A gram-negative bacillus. B. A gram-positive bacterium. C. A pathogenic protozoan. D. A non-enveloped virus. Correct answer B. Knowledge point explanation. Core rationale, Geobacillus, specifically Geobacillus stereothermophilus, is scientifically classified as a gram-positive, rod-shaped bacterium capable of forming incredibly tough endospores. Its thick peptidoglycan cell wall retains the primary stain, identifying it as gram-positive. Trap analysis. Option A is incorrect because while it is a rod, bacillus, it is not gram-negative. Organisms like Escherichia coli and Pseudomonas are classic examples of gram-negative bacteria. Option C is incorrect because a protozoan is a complex, single-celled eukaryotic animal-like organism, totally unrelated to bacterial spores used for steam testing. Option D is incorrect because viruses are subcellular agents, whereas Geobacillus is a complete bacterial cell. Concept extension. If the steam sterilizer fails to reach the required 270 degrees Fahrenheit 132 degrees Celsius or lacks sufficient exposure time, these gram-positive spores will survive, turning the incubation liquid from purple to yellow, indicating a positive failure. Question 10. Microorganisms are physically classified into specific morphological categories that directly impact how they hide in the serrations of surgical instruments and how technicians identify them. Which of the following terms is strictly not a scientifically recognized primary shape classification for bacteria? A. Spherical, cocci. B. Spiral, spirilla. C. Cylindrical. D. Rod, bacilli. Correct answer C. Knowledge point explanation. Core rationale. The three fundamental, standard classifications for bacterial shapes taught in clinical microbiology are cocci, spherical, bacilli, rod-shaped, and spirilla, spiral. While a bacillus rod might visually resemble a tiny cylinder under a microscope, the word cylindrical is not the accepted scientific taxonomy term. Trap analysis. Option A is incorrect because spherical correctly describes cocci, such as the dangerous Staphylococcus clusters. Option B is incorrect because spiral correctly describes spirilla, which navigate through fluids with a corkscrew motion. Option D is incorrect because rod is the precise, scientifically accepted description for bacilli, such as the pathogens causing tuberculosis. Concept extension. Recognizing these three primary shapes is the first step in assessing the physical bioburden load on medical devices, as the shape dictates how easily an organism can be mechanically flushed from a lumen. Question 11. An instrument technician in the Sterile Processing Department, SPD, accidentally leaves a blood-soaked orthopedic tray in a 75 degrees Fahrenheit 24 degrees Celsius staging area for 4 hours. The clinical educator warns that the microscopic organisms on the bone rungers are multiplying exponentially because each individual vegetative cell is splitting into 2 equal cells every 20 minutes. What is the specific scientific term for this rapid reproductive process? A. Repopulation. B. Binary fission. C. Replication. D. Bilateral reproduction. Correct answer B. Knowledge point explanation. Core rationale. Binary fission is the primary method of asexual reproduction for bacteria, where a single parent cell divides into 2 identical daughter cells. This mechanism allows for explosive exponential growth when pathogens are exposed to ideal temperatures, moisture, and organic nutrients, like blood. Trap analysis. Option A is incorrect because repopulation is a generic ecological term for numbers increasing again, not a specific cellular division mechanism. Option C is incorrect because replication specifically refers to the copying of DNA inside the cell prior to division, not the entire physical splitting process itself. Option D is incorrect because bilateral reproduction is a fabricated, non-standard term in microbiology. Concept extension. A single bacterium can multiply into over 1 billion organisms in less than 10 hours, making immediate point-of-use pre-treatment critical. Question 12. During an infection control audit in the decontamination area, a new employee asks why the facility's strict chemical disinfection protocols do not target every single microscopic organism on the surgical instruments. The supervisor explains that while many environmental organisms are completely harmless, the department's primary mission is to eradicate the specific microorganisms that possess the potential to cause human disease. What is the correct medical term for these disease-causing agents? A. Gram-positive bacteria. B. Gram-negative bacteria. C. Pathogens. D. Potentially infectious materials. Correct answer C. Knowledge point explanation. Core rationale. A pathogen is strictly defined as any biological agent, particularly a microorganism such as a bacterium, virus, or fungus, that can cause disease in its host. Trap analysis. Options A and B are incorrect because gram-positive and gram-negative are simply structural classifications based on cell wall thickness. While some in these categories cause disease, many others are harmless or beneficial. Option D is incorrect because potentially infectious materials is an OSHA broad descriptive term for fluids, like blood, whereas the organisms themselves are classified as pathogens. Concept extension. Standard precautions dictate that technicians must treat every instrument as if it is heavily contaminated with deadly pathogens, utilizing proper personal protective equipment, PPE, at all times. Question 13. In the study of fundamental clinical microbiology, human cells and certain complex microscopic organisms possess a distinct internal structure that contains the genetic blueprint, DNA, and directs all cellular activities. What is the name of this functional center of the cell? A. Cytoplasm. B. Cell membrane. C. Nucleus. D. Capsule. Correct answer C. Knowledge point explanation. Core rationale. In eukaryotic cells, the nucleus is the functional command center that houses the genetic material and controls cellular replication, metabolism, and heredity. Trap analysis. Option A is incorrect because the cytoplasm is the thick, jelly-like fluid that fills the cell and surrounds the internal structures. Option B is incorrect because the cell membrane is the semi-permeable outer boundary that regulates the intake of nutrients. Option D is incorrect because a capsule is an additional protective outer slime layer found on some bacteria. Concept extension. Pathogenic bacteria, being prokaryotes, do not have a true defined nucleus but instead have a nucleoid region where their single circular chromosome resides. Question 14. A decontamination technician is aggressively brushing a cannulated orthopedic reamer without wearing the required full-face shield. A droplet of fluid from the soiled instrument splashes directly into their eye. If the patient was actively infected with the hepatitis B virus, what is the primary transmission route for this specific occupational hazard? A. Direct skin contact. B. Blood. C. Airborne and droplet routes. D. Vectors, insects or rodents. Correct answer B. Knowledge point explanation. Core rationale. Hepatitis B is a highly resilient bloodborne pathogen. It is primarily transmitted through occupational exposure to infected blood or specific body fluids entering through mucous membranes, like the eyes, or non-intact skin. Trap analysis. Option A is incorrect because simply touching intact skin of an infected person does not transmit hepatitis B. It requires blood-to-blood or fluid-to-mucous membrane contact. Option C is incorrect because airborne routes are typical for respiratory illnesses like tuberculosis, not hepatitis B. Option D is incorrect because vectors like mosquitoes transmit malaria, not hepatitis viruses. Concept extension. Due to its resilience, the hepatitis B virus can survive outside the body on environmental surfaces in dried blood for at least 7 days, making surface disinfection critical. Question 15. While bacteria and viruses represent the most common biological hazards in the sterile processing department, SPD, technicians must also understand other categories of microorganisms that thrive in dark, moist environments. Which of the following common clinical conditions is scientifically classified as being caused by a fungus? A. Pneumonia. B. Tuberculosis. C. Athlete's foot. D. Herpes simplex. Correct answer C. Knowledge point explanation. Core rationale. Athlete's foot, tinea pedis, is a highly common infection caused by dermatophytes, which are a group of multicelled fungi that thrive in warm, moist environments. Trap analysis. Option A is incorrect because while pneumonia can rarely be fungal, it is predominantly a bacterial or viral respiratory disease. Option B is incorrect because tuberculosis is caused by Mycobacterium tuberculosis, which is an acid-fast bacillus bacterium. Option D is incorrect because herpes simplex is strictly caused by a viral infectious agent. Concept extension: unlike bacteria, many fungi are aerobic decomposers. To prevent fungal colonization on medical devices, thorough drying processes are an absolute requirement before packaging.